Why do I have bacteria in my urine? Have you ever wondered why bacteria sometimes show up in your urine? It might seem confusing, but it's actually quite common and usually related to infections in your urinary tract. Your urinary tract includes your kidneys, ureters, bladder, and urethra, and normally, it is free of bacteria. When bacteria are present, it often indicates that they have entered your urinary system and started multiplying, which can lead to a urinary tract infection. The most common bacteria responsible is Escherichia coli, or E. coli, which naturally live in your digestive system. These bacteria can sometimes travel from the anus to the urethra, the tube that carries urine out of your body. From there, they can ascend into the bladder, causing an infection. Other bacteria like Mycoplasma and Chlamydia can also cause urinary infections, especially through sexual contact. Several factors can make it easier for bacteria to enter and grow in your urinary tract. For women, a shorter urethra means bacteria have a shorter distance to travel to reach the bladder. Sexual activity can introduce bacteria into the urinary system, especially if good hygiene isn't maintained. Blockages such as kidney stones or an enlarged prostate can obstruct urine flow, creating a breeding ground for bacteria. Sometimes urine flows backward from the bladder toward the kidneys, which can also promote infection. Medical devices like urinary catheters can introduce bacteria directly into the urinary tract, and a weakened immune system or other health issues can make it harder for your body to fight off bacteria. If bacteria are in your urine, you might notice symptoms like a burning sensation or pain when you urinate, a frequent or urgent need to go, cloudy or foul-smelling urine, blood in your urine, or lower abdominal discomfort. Sometimes, especially if the infection reaches your kidneys, symptoms can worsen to include fever, chills, nausea, vomiting, and pain in your sides or back. Interestingly, some people may have bacteria in their urine without any symptoms, a condition called asymptomatic bacteriuria. This is often harmless but might need treatment in specific groups like pregnant women to prevent complications. To find out exactly what bacteria are causing the problem, doctors usually perform urine tests such as urinalysis and urine culture. These tests help identify the bacteria and determine the best antibiotic treatment. If infections keep coming back, or if there are structural issues in your urinary system, imaging tests might be needed to look deeper. From a bladder health perspective, it's important to understand that repeated or untreated urinary infections can cause ongoing inflammation of the bladder lining. While urinary tract infections themselves are not directly linked to bladder cancer, chronic inflammation and irritation can sometimes contribute to bladder health issues over time. That's why timely diagnosis and proper treatment are essential. If you notice symptoms or have bacteria in your urine, seeing a healthcare professional is the best step. Self-treatment can lead to complications like kidney infections, which are more serious. In summary, bacteria in your urine usually happen because bacteria have entered your urinary tract and started multiplying, most often causing a urinary tract infection. Proper diagnosis and treatment are key to keeping your bladder healthy and preventing more serious problems down the line. Always consult with a healthcare provider for personalized advice and care.